Welcome to another deep dive. Today we're tackling a listener request. Someone sent us this speech about the challenges facing American healthcare, and, well, let's just say it's pretty thought-provoking.
Definitely a bit of a wake-up call.
Yeah, it really throws down the gauntlet, doesn't it? Okay, so right off the bat, this speech hits us with some hard-hitting statistics. 6 out of 10 adults in the U.S. have at least one chronic disease.
And 4 in 10.
4 in 10 are dealing with 2 or more. I mean, think about that for a second. Statistically speaking, you or someone you know is probably part of that group.
It's a sobering thought.
It really is, and it's not just those numbers. The U.S. has the highest cancer rate out of, get this, 204 countries.
Wow.
Yeah, and we're talking almost double the rate of the next highest country. Then you've got the rise of autism, fatty liver disease, obesity in kids. It's a lot.
It makes you wonder what's changed.
Right. So the speech takes us back to the 1960s. Think about it. Back then, these conditions were practically unheard of. It's a completely different picture from what we see today. And it's not just those conditions either. We're talking about declining sperm counts and testosterone in men.
Yeah.
And earlier onset of puberty in girls compared to like our grandparents' generation. It's wild.
It really highlights how much things have shifted, biologically even.
Absolutely. And the speech even suggests that our reliance on pharmaceuticals might be part of the problem.
Well, yeah, I mean, medication definitely has its place, but it feels like sometimes we're just putting a Band-Aid on the issue instead of getting to the root cause.
I think that's what the speech is getting at. It specifically points to all the kids on medication for ADD and ADHD.
Right. And it asks, are we truly helping them, or are we just managing symptoms?
Exactly. And this leads to another huge issue, the financial burden of all these chronic diseases. I mean, 90% of healthcare spending in the U.S. goes towards managing them. That's a lot.
It's a staggering amount, over $4 trillion a year. And here's the kicker. It's 2 to 3 times more than what European nations spend. And their health outcomes are often worse.
So we're spending more, but not necessarily getting better results.
Exactly. Makes you think, doesn't it?
And then you bring COVID into the mix, which, as the speech points out, really exposed just how vulnerable Americans are when it comes to their health.
Yeah, 4.2% of the world's population, but we accounted for 16% of global COVID deaths. It's a pretty stark contrast.
And this is where it gets really interesting. The CDC reported that the average American COVID fatality had, wait for it, 3.8 chronic diseases.
3.8, wow.
I know, right? So it raises the question, were they dying from COVID or were those pre-existing conditions a major factor?
It's a really important question, and it speaks to the bigger issue of chronic disease in this country.
Absolutely. And that leads us to this idea of radical transparency in healthcare that the speech is advocating for. Transparency in research, in costs, in treatment options, everything.
I see where they're going with that. I mean, transparency builds trust, right? Not just in science, but in the whole system.
Exactly. And it empowers people to make informed decisions about their own health.
Informed consent is crucial. It's like the foundation of a good patient-doctor relationship.
Totally. And I think that's what the speech is getting at. It questions why we're so focused on who paying for healthcare and not on why it costs so much in the first place. It's like we're missing the forest for the trees.
I think you're right. We need to understand the root of the problem if we're ever going to fix it. And I think the speech is arguing that transparency is key to having that honest conversation.
And then there's this whole issue of politicization, right? It's like healthcare has become this battleground.
Well, yeah, the speech argues that health should be about science and compassion, not political agendas.
It shouldn't be a left or right issue. It should be a human issue.
Exactly. We're all in this together, right? And when you let financial interests and political agendas dictate healthcare decisions, it's hard to see how that's truly serving the people.
So how do we shift the focus? What can we do to make healthcare more about the individual?
That's a big question. But the speech suggests that we can start by focusing on the 160 million Americans who rely on Medicare and Medicaid.
Those are huge programs.
Absolutely. And the speech suggests that we could use technology, the same kind of tech that's used to uncover fraud, to actually improve individual care.
Okay, I'm intrigued. So instead of just policing the system, we're using data to make it better for the people in it.
Exactly. It's like shifting from a reactive approach to a proactive one.
I like that. It's about empowering people, not just managing them. And speaking of empowerment, the speech takes an interesting turn when it starts talking about spiritual well-being.
It's not what you typically expect to hear in a discussion about healthcare.
Right, but it argues that we can't ignore this dimension of health, especially with all the talk about chronic diseases and this like sense of societal malaise.
The speech calls it a spiritual malaise.
Right, exactly. And it particularly points to young people, this feeling of alienation, disconnection, and lack of hope.
It's like they're saying our mental and emotional states are just as important as our physical health.
Exactly. So how do we address that on a societal level?
That's the million-dollar question. But the speech suggests that fostering a sense of belonging, connection, and purpose are key.
It sounds like we need a pretty major societal shift, right? It's not like we can just take a pill for this.
Well, it's definitely a complex issue, but the speech argues that it's a necessary conversation to have. It suggests that we need to look beyond just physical health and consider the whole person.
I think that's a really important point. And this brings us to the Emeja Commission, which the speech highlights as a key initiative.
Oh yes, the Epidemic Commission. It's tasked with investigating the potential causes of this decline in American health.
And they're not afraid to tackle some controversial topics either.
Not at all. The speech mentions things like vaccine schedules, electromagnetic radiation, glyphosate, ultra-processed foods, and psychiatric drugs.
Those are all things that people have really strong opinions about. It seems like a bold move to include them in the investigation.
It is bold, but the speech emphasizes that the Commission is committed to unbiased science. They want to reach conclusions based on evidence, not ideology.
So it's about following the science wherever it leads, even if it's uncomfortable or challenges conventional wisdom.
Exactly. They're not shying away from difficult questions.
It'll be interesting to see what they find and how their findings impact the conversation about American healthcare. This could be a real game changer.
I agree. It has the potential to be really transformative.
But the speech doesn't just leave it at that. It also calls out specific entities that it believes are contributing to the problem. Organizations like the CBC and the FBA.
It's pretty critical of them, suggesting that they're prioritizing profits over public health.
Those are some pretty serious accusations. It makes you wonder, are they really looking out for the best interests of the American people?
It's a valid question, and it speaks to this larger theme of accountability and transparency that the speech keeps coming back to.
So, if these organizations are part of the problem, what's the solution?
Well, the speech proposes a pretty radical shift. Instead of focusing on just oversight, it suggests that we should be focusing on actually improving the quality of care for individuals.
So it's not just about catching people doing wrong, it's about helping them do better.
Exactly. And it specifically highlights the 160 million Americans who rely on Medicare and Medicaid.
Those are massive programs. What kind of changes does the speech envision for them?
Well, it talks about using technology, similar to the tech used to uncover fraud, but using it to actually improve the care people receive. It's an interesting concept.
It is. It's like taking that data and using it for good. It makes me think about all the potential there is to really personalize healthcare.
Exactly. And it's about creating a culture within HHS that prioritizes the well-being of individuals over bureaucracy and profit.
That sounds like a tall order. What do you think are the biggest obstacles to achieving that kind of transformation?
Honestly, I think one of the biggest challenges is going to be overcoming the entrenched interests and the power dynamics that are already in place.
So it's about challenging the status quo, right? It's about demanding better from the systems that are supposed to be serving us.
Exactly. And that brings us back to this idea of individual agency, which the speech emphasizes over and over again.
We're not just passive recipients of healthcare. We have the power to shape our own health and influence the system.
We have more power than we often realize. And that's a really empowering message, don't you think?
It definitely is. It gives us a sense of hope and possibility. And it leads us perfectly into the final part of the speech, which focuses on the individual and the power of personal choices.
So we're moving from the big picture to the personal level.
Exactly. And I think that's where things get really interesting. We'll dive into that in the next segment. Stay tuned. It's definitely a lot to consider. I mean, we've talked about chronic diseases, the role of pharmaceuticals, the financial strain on the system, and now this concept of a spiritual malaise. It feels like we're peeling back the layers of an onion, doesn't it?
It does, and each layer reveals a new complexity to the issue of American healthcare. But what I find fascinating is how the speech ties these seemingly disparate elements together.
I'm with you on that. It's not just presenting a list of problems. It's trying to connect the dots and offer a more holistic understanding of the situation. What are your thoughts on the connection between this spiritual malaise and the rise in chronic diseases?
It's a really thought-provoking concept. The speech argues that this feeling of alienation, disconnection, and lack of purpose, particularly among young people, can manifest in physical ways.
So you're saying our mental and emotional state could be contributing to physical health problems?
Exactly. It's not a new idea. The mind-body connection has been explored for centuries. But the speech is bringing it into the conversation about the state of American healthcare. And it's making a bold statement by saying that we can't ignore this spiritual dimension if we want to truly address the health crisis.
That makes a lot of sense, but what does that look like practically? How do we address this spiritual malaise on a society level?
Well, the speech doesn't offer a simple prescription, but it does point us in a direction. It suggests that we need to foster a sense of belonging, connection, and purpose.
So it's about more than just individual lifestyle choices. It's about creating a society that supports well-being on multiple levels.
Precisely. It's about addressing social isolation, promoting meaningful work, and encouraging people to find purpose beyond material consumption.
This feels like a huge societal shift. It's not something that can be fixed with a pill or a policy change, is it?
It's definitely a complex challenge, but the speech suggests that it's a necessary one. And it reminds us that even small steps can make a difference.
Like what? What are some examples of things individuals can do to cultivate this sense of spiritual well-being?
The speech points to things like fostering meaningful relationships, engaging in activities that bring joy and purpose, spending time in nature, and connecting with something larger than oneself.
So it's about finding ways to live a more connected and fulfilling life. It sounds a lot like what we might consider self-care, but with a broader societal impact.
That's a great way to put it. And the speech argues that when individuals prioritize their own well-being, it creates a ripple effect that benefits the community as a whole.
This brings us to the MAHA Commission, which the speech highlights as a key initiative. Can you remind us about its mission and what makes it so unique?
The MAHA Commission is tasked with investigating the potential causes of the decline in American health over the past couple of generations. And what makes it particularly interesting is its commitment to examining a wide range of factors, including some that have been considered controversial or under-researched.
The speech specifically mentions childhood vaccine schedules, electromagnetic radiation, glyphosate, ultra-processed foods, and psychiatric drugs. These are topics that tend to spark heated debates and generate strong opinions. Why do you think the Commission is choosing to delve into these potentially contentious areas?
I think it's a testament to their commitment to a truly comprehensive investigation. They're not shying away from difficult questions or potential controversy. Their goal is to follow the evidence wherever it leads, even if it challenges conventional wisdom.
That's a bold approach, but it also seems like it could open them up to criticism from all sides. Do you think they'll be able to maintain their objectivity and produce findings that are widely accepted?
It's certainly a challenge, but the speech emphasizes that the Commission is committed to unbiased science and transparency. They're involving experts from diverse fields and perspectives, and they're committed to making their findings publicly available for scrutiny.
So they're not just trying to prove a point or push a particular agenda. They're genuinely seeking to understand the complex factors contributing to the decline in American health.
Exactly. And they're doing it in a way that invites open dialogue and debate.
It'll be interesting to see what they uncover and how their findings will impact the conversation about American healthcare moving forward.
I agree. It has the potential to be a real game changer.
Now, this speech doesn't shy away from pointing fingers, does it? It names some specific entities it believes are contributing to the problem.
You're right. It specifically calls out organizations like the CDC and the FDA, accusing them of prioritizing profit over public health.
These are pretty serious accusations. But the speech also suggests a way forward, doesn't it? It proposes a shift in focus from just oversight to actually improving the quality of care for individuals, particularly those relying on Medicare and Medicaid.
It does, and it specifically highlights the potential of technology to personalize care and improve outcomes for the 160 million Americans who depend on these programs.
That's a really interesting idea. It's like using data not just to catch fraud, but to actually improve people's lives.
Exactly. It's about using technology to empower individuals and healthcare providers to make more informed decisions.
I like that a more proactive and personalized approach to healthcare, but it also feels like it would require a significant cultural shift within these organizations.
It definitely would. The speech talks about setting a new standard of courtesy, efficiency, professionalism, and integrity within HHS.
So it's about more than just implementing new technologies. It's about changing the way these organizations operate and interact with the people they serve.
It's about creating a culture that prioritizes the well-being of individuals over bureaucracy and profit.
That's a tall order, but it's certainly an inspiring vision. What do you think are the biggest obstacles to achieving this kind of transformation within the healthcare system?
I think one of the biggest challenges is overcoming the entrenched interests and power dynamics that often prioritize profit over people. The speech is quite critical of the influence of pharmaceutical companies and insurance companies, for example.
So it's about challenging the status quo and pushing for a system that truly prioritizes the well-being of individuals and communities. That's a pretty big task.
It is. But the speech also reminds us that we're not powerless. We have the ability to make choices that support our own health and well-being, and we can demand better from the systems that are supposed to serve us.
That brings us back to this idea of individual agency. We're not just passive recipients of healthcare. We have the power to shape our own health and influence the system. What are your thoughts on that?
I think it's incredibly empowering. The speech is essentially saying, don't wait for someone else to fix it. Start taking control of your own health and well-being.
So it's not just about waiting for the MECA Commission's findings or for policy changes. It's about taking action now.
Exactly. And it's about recognizing that even small changes in our daily lives can make a difference.
This deep dive has been a real journey. We've explored some complex and challenging ideas. What are your main takeaways from this discussion so far?
For me, it's the interconnectedness of it all. We can't just look at healthcare in isolation. It's tied to our environment, our lifestyles, our mental and emotional well-being, and even our sense of purpose and connection.
It's about seeing the whole picture, isn't it? And recognizing that even seemingly small choices can have a ripple effect.
Absolutely. And it's about understanding that we have more agency than we often realize.
This leads us to the final part of the speech, which focuses on the individual and the power of personal choices. Let's delve into that in the next segment and see how we can apply these insights to our own lives. So we've talked about the big picture, the challenges, the potential solutions. But now let's bring it back to you, the listener. What can you do to take control of your health? This is where the speech really gets personal.
It does. It shifts gears and focuses on the power of individual choices. After all, we can't just wait for the system to fix itself, right?
Exactly. We have to take responsibility for our own well-being. So what does that look like? What kind of everyday choices can make a real difference?
Well, the speech highlights a few key areas. First, it talks about food. It really encourages people to choose real, whole foods over processed foods.
That makes sense. We hear that a lot these days, but it's easy to get caught up in the convenience of processed foods.
It is. But the speech reminds us that those seemingly small choices about what we eat can have a huge impact on our health.
And it's not just about food, right?
Nope, not just food. The speech also talks about the importance of movement, finding ways to move our bodies regularly.
So exercise.
Yeah, but it doesn't have to be about hitting the gym every day. It's about finding activities that we enjoy, things that get us moving and keep us active.
I like that. It's about making it sustainable, finding things that we'll actually stick with.
Exactly. And then the third piece of the puzzle, according to the speech, is connection, cultivating meaningful relationships with others.
That's interesting. We often think about health in terms of diet and exercise, but the speech is saying that social connection is just as important.
Absolutely. It's about fostering a sense of belonging, community, and support. It's about fighting that loneliness and isolation that we talked about earlier.
So it's about taking care of ourselves physically, mentally, and socially. It's a holistic approach.
Exactly. And the speech emphasizes that it's not about perfection. It's about progress, not perfection.
That's a good reminder. It's so easy to get caught up in the all or nothing mentality, but that can be really discouraging.
It can. And the speech is saying, hey, just start where you are. Make small changes one step at a time.
And it's okay to ask for help.
Absolutely. We don't have to do this alone. There are resources, communities, people who can support us on this journey.
That's such an important point. We don't have to figure it all out on our own.
And I think that's one of the most hopeful messages of this speech. It's not about despair or resignation. It's about empowerment and action.
It's about taking back control, right? It's about realizing that we have more power than we think to shape our own health and well-being.
Exactly. We started this deep dive with some pretty alarming statistics, but I think we're ending on a note of hope and possibility.
I agree. This speech has given us a lot to think about, but more importantly, it's given us a sense of agency. It's reminded us that we're not powerless in the face of these challenges.
And that's a powerful message.
Well said. Thanks for joining us on this deep dive into American healthcare. We hope you found it informative and empowering. Remember, you have the power to make choices that support your health and well-being, so go out there and do it. Until next time, take care.